landmarks at the anterior view of skull, because we have discussed the sutures inside of the orbit formally, so they will be skipped. First, there is a frontal nasal suture between the frontal bone and the nasal bone. And the frontal maxillary suture is continued like this. Frontal maxillary suture, and the internasal suture is here. And the zygomatic-maxillary suture is here, and it continues in the inside of the orbit. Zygomatico-maxillary. And the nasomaxillary sutures are here and here. And the zygomatico-temporal suture, these sutures are not easily seen in this picture because it is located nearly in the lateral side. And the intermaxillary sutures here. And the frontozygomatic suture is here. Moving on to the anatomic landmarks of anterior view of skull. The anatomic landmarks are usually designated at the location of sutural intersections, prominent points of convexity, borders of opening or foramen, and so on. These landmarks are utilized on diagnostic purposes or predictive purposes during orthodontic treatment. Please note some landmarks have different definitions whether they are used in anthropological craniometry or orthodontic cephalometry. Let's start with the gnathium or gnathium. In fact, this landmark has a variable definition. Generally and craniometrically, it is the most inferior point of the mandible in the midline. In that case, gnathium located here. But orthodontically, it denotes the point located perpendicular on mandibular symphysis, midway between Pogonian and menton. The most inferior point of the mandibular symphysis in midline is usually called as a menton instead of gnathium in orthodontic cephalometry. For your better understanding, I will draw the mid-sagittal view of the mandibular symphysis. Like this, and we have a mandibular central incisor here, and the craniometrical definition. By craniometrical definition, the lowermost or lowest point of mandibular symphysis is located here, and it can be defined as a gnathion in craniometrical sense, but we dentists used this point as usually menton, following the orthodontic notion. And the move on to the next landmarks. Pogonian. Pogonian is the most anterior point of the mandibular symphysis. So in this mid-sagittal figure, this is the This is the most anterior point, so this is the pogonion. So in this frontal figure, there may be pogonion around here, and this point can be menton, and nathion by orthodontic notion probably located around here, because by definition the point located perpendicular on mandibular symphysis between menton and pogonion, so it can be that like that, and this point is nathion. Okay, the next is the infradental, the apex of the septum between mandibular central incisor. There is a septum between teeth like that. This is the apex of septum, so in this figure we can find the infradental here and the supradental here, and the nasospinale is the point of intersection of a line uniting the lowest points of the margin of each nasal opening with the mid-sagittal plane. So its meaning is nearly the anterior nasal spine. And the rhinian is the anterior tip of the end of the suture of the nasal bone. So the rhinian is here. And the nasion, the very important point, most anterior point of the frontonasal suture that joins the nasal part of the frontal bone and nasal bone. So by definition we can dot here the nasion or N. It marks the midpoint at the intersection of the frontonasal suture. This is the frontonasal suture with internasal suture here, joining the nasal bones. Next, supraorbital, the highest point on the upper edge of the cranial orbit. Probably here is the supraorbital. Now we're moving on to the anatomic landmark of the anterior view of skull. The anatomic landmarks are usually designated at the location of sutural intersections, prominent points of convexity, borders of opening or foramen, and so on. These landmarks are utilized on diagnostic or protective purposes during orthodontic treatment. Please note some landmarks have different definitions whether they are used in anthropological craniometry or orthodontic cephalometry. Let's start with nathion, which is a variable definition. Generally and craniometrically, it is the most inferior point of the mandible in the midline. In that case, this can be a nathion, but orthodontically, because we are a dentist, it denotes the point located perpendicular or mandibular symphysis midway between pogonion and menton. It's more difficult definition, and for your better understanding, I will draw the mid-sagittal plane view of the mandibular symphysis. It can be drawn like this, and we have a mandibular central incisors, and the most anterior point of the mandibular symphysis in midline or mid-sagittal line can be a pogonion, and the lowest point by craniometrical definition is the nathion. But orthodontically, this point are usually called as a menton instead of nathion. So we follow this orthodontic notion. And the Nathion is the point located perpendicular on mandibular symphysis midway between Pogonion and Menton. So in this curvature midway between Pogonion and Menton, in the center, probably this is the same length, or in this straight line we can have a perpendicular line intersected the curvature of the mandibular symphysis in this area. So this point can be Nathion by orthodontic concept. So we follow the orthodontic concept in this lecture. So here is the Menton, probably Nathion, and Pogonion. Okay, move on to the next landmark, infradental. Infradental is the apex of septum between the mandibular central incisors. The apex of septum means that there are two adjacent tooths, and between the adjacent tooths there will be alveolar sockets, and there is a projection or septum, and which has a apex here. So the infradental is here, and by the same concept, the supradental is here between the central maxillary central incisors. And the nasospanale. Nasospanale is the point of intersections of line uniting the lowest point of the margin of each nasal opening at the lowest margin, and between a line uniting the lowest point of the margin of each nasal opening. So around here there will be nasospinale. It is commonly used with the same meaning of the anterior nasal spine. And the next, rhinion. Rhinion is the anterior tip of the end of the suture of the nasal bone. So this is the rhinion. The next is the most important point among the points viewed on the anterior view of the skull is a nasion. Nasion is here. Most anterior point on the frontonasal suture. This is a frontonasal suture, and the most anterior point is here, and usually it marks the midpoint at the intersection of the frontonasal suture with the internasal suture. Internasal suture is here. So this is the nasion, and we write the nasion as NA or N. Supraorbital. Supraorbital is a rarely used point, and by definition it is the midpoint between the highest point on either side of the upper edge of cranial orbit. So we must put a dot on either side the upper edge of the cranial orbit, here and here, and the line connecting here, and the midpoint may be here, and this is the supraorbital. And the orbital. Orbital is most commonly and most prevalently used because it is used on the Frankfurt horizontal plane, as I said in the former video clips. The lowest point on the lower edge of the cranial orbit. This is a bilateral point. Here and here is an orbital. And the glabella. Glabella is the most prominent point, which is not discrete in the Asian population. In the median sagittal plane between supraorbital ridges, probably above the supraorbital, here is the glabella. And the zyzion. Zygon is the craniometric point at either end of the bizygomatic diameter. In other words, the most lateral point of the soft tissue contour of each zygomatic arch. So it can be dot as here. This length should be the maximum bizygomatic diameter. Finally, in zygomatic maxillary, ZM is the lowest point of zygomatic maxillary sutures. Here and here is the zygomatic maxillary sutures. Okay, this is the end of the anterior view of the skull. Thank you for listening.